Pulmonary hypertension from the word itself pulmonary, which means lungs, and hypertension, which means high blood pressure, is a high blood pressure in the blood vessels of lungs. Pulmonary hypertension occurs when the pressure in the blood vessels that carry blood from your heart to your lungs is higher than normal. In a normal blood circulation, the right ventricle pumps the oxygen-poor blood to the lungs through the pulmonary valve. The left atrium receives oxygen-rich blood from the lungs and pumps it to the left ventricle through the mitral valve. The left ventricle pumps the oxygen-rich blood through the aortic valve out of the rest of the body. But with pulmonary hypertension, the blood vessels to the lungs develop an increased amount of muscle in the wall of the blood vessels. The heart pumps blood from the right ventricle to the lungs to get oxygen. Because the blood does not have to travel far, the pressure in this side of the heart and in the artery taking blood from the right ventricle to the lungs is normally low, usually much lower than systolic or diastolic blood pressure. When the pressure in this artery gets too high, the arteries in the lungs can narrow and then the blood does not flow as well as it should, resulting in less oxygen in the blood. There are clinical classifications of the pulmonary hypertension that categorize into 5 groups. First group is the pulmonary arterial hypertension. That is a rare progressive disorder characterized by high blood pressure in the arteries of the lungs. It is caused by the arteries in the lungs that is narrowed, thickened, or stiff. It is idiopathic and hereditary. Second group is the pulmonary hypertension due to left heart disease that is congenital or acquired cardiovascular conditions leading to postcapillary PH. It causes problems with how the heart squeezes or releases blood. Third group is the pulmonary hypertension due to lung disease that can trigger obstructive and restrictive pulmonary diseases. It can have also developmental lung disorders. It causes lung airways to narrow and make it harder to exhale and tightening leads high blood pressure throughout the lungs. Fourth group is the chronic thromboembolic pulmonary hypertension that occurs when the body is not able to dissolve blood clot in the lungs. Fifth group is the pulmonary hypertension due to unclear multifactorial mechanisms that are associated with systemic disorders like sarcoidosis, hematologic disorders like sickle cell anemia, and metabolic disorders. Some common underlying causes of pulmonary hypertension include high blood pressure in the lungs and arteries due to some types of congenital heart disease, connective tissue disease, coronary artery disease, high blood pressure, liver disease, and chronic lung diseases like emphysema. Genetics also play a role. The signs and symptoms of pulmonary hypertension develops slowly. You may not notice it for months, even for years. Symptoms get worse as the disease progresses. Pulmonary hypertension symptoms include shortness of breath, fatigue, dizziness, chest pain, edema, bluish color of the skin or cyanosis, and heart palpitations. Diagnostic testing is used to confirm that pulmonary hypertension exists, determine its severity, and identify its causes. Initial diagnostic evaluation includes a history assessment, physical examination, chest x-ray, pulmonary function test using spirometer, electrocardiogram, and echocardiogram. Echocardiography can be used to estimate the pulmonary artery systolic pressure and to assess right ventricular size, thickness, and function. It can also evaluate the right atrial size, left ventricular system, and diastolic function, as well as valve function. Right heart catheterization is used to confirm the diagnosis of pulmonary hypertension and to accurately assess the hemodynamic abnormalities. Pulmonary hypertension is confirmed if the mean pulmonary artery pressure is greater than 25 mm per mercury. Electrocardiogram is a non-invasive test that shows heart's electrical patterns and detects heartbeats. Chest X-ray creates pictures of the heart, lungs, and chest and can show enlargement of the right ventricle. Pulmonary function tests may be normal or show a slight decrease in vital capacity and lung compliance with a mild decrease in the diffusing capacity. The primary goal of treatment is to manage the underlying condition related to pulmonary hypertension if the cause is known. All patients with pulmonary hypertension should be considered for the following therapies: diuretics, oxygen therapy, anticoagulants, and digoxin. Different classes of medications are used to treat pulmonary hypertension. This includes calcium channel blockers, protonoids, endothelin antagonists, and phosphodiesterase type 5 inhibitors. Calcium channel blockers are usually prescribed on patients with a positive vasoreactivity test. They are taken orally and generally less costly, but are indicated only on a small percentage of patients. Prostanoids mimic the effect of the prostaglandin prostacyclin that relaxes the vascular smooth muscle. Endothelin antagonists are vasodilators and is prescribed for its antihypertensive effects in patients with pulmonary hypertension. Specific phosphodiesterase type 5 inhibitors like sildenafil and tadalafil are potent inhibitors that degrade cyclic guanosine monophosphate and promotes pulmonary vasodilation. These drugs are also prescribed to treat erectile dysfunction. There are also treatments like pulmonary thromboendarectomy, which is used to surgically remove the blood clots in the pulmonary artery to improve blood flow and lung function. The other one is the lung transplant, which is a surgical procedure to replace a diseased or failing lung with a healthy lung. The major nursing goal is to identify patients at high risk for pulmonary hypertension, such as those with chronic obstructive pulmonary disease, congenital heart, and mitral valve disease, so that early treatment can commence. The nurse must be alert for signs and symptoms. Administer oxygen therapy appropriately. Instruct the patient and family about the use of home oxygen therapy. In patients treated with prostanoids, education about central venous access, subcutaneous infusion, proper administration and dosing of the medication, pain at the injection site, and potentially severe side effects is extremely important.